Welcome back to the Mountain Morning Show. Today we are talking all about health and wellness, and November is National Diabetes Month. So here to tell us more about that is Beth Armstrong and Aimee from People's Health Clinic, as well as SoRene Brooks from the Health Department of Summit County. So what do we have going on?
Well, November is National Diabetes Month, as you said. November 14th, next Wednesday, is World Diabetes Day, and we are doing a diabetes awareness clinic with the health department to get people tested so for pre-diabetes and diabetes so we can help them if they are affected.
Oh, that's great. So you have all month long, though, in November, you have things going on. Tell us more about those activities.
Well, everything is leading up to our Wednesday because this is there are more than 820,000 people in Utah affected by diabetes who have either pre-diabetes or diabetes. And so many people don't realize that they have this disease. Actually, 1 in 3 people have diabetes and don't even know it. So these are our efforts this month, is to try and get as many people diagnosed as possible, because diabetes is a cumulative disease. So the sooner you know you have it or are affected by it or are at risk for it, the quicker you can get healthy.
Oh, absolutely. That's staggering. 1 in 3.
1 in 3. So many people think that Utah is not affected, but we are affected. And Summit County, Park City, Wasatch County have all declared November as Diabetes Awareness Month because so many people are affected.
Oh, definitely. And SoRene, you're here from the Health Department. How is the Health Department working with People's Health Clinic to help get this message out?
So we're working together to put together this event, and we did it last year, and it was a great success. And we were able to help people identify if they were either at risk for diabetes or had diabetes. So we were really excited about that. And we have other partners that are going to be helping us with this. People can come and get screened for, take a risk test and see if they might be at risk for type 2 diabetes. And then they can also have a blood glucose test done, an A1C test, their BMI. Those are all things that will show their level of risk for diabetes, because those numbers of people that are affected by diabetes also include pre-diabetes. And that's something that people can do something about. So if they can do something to prevent or delay getting type 2 diabetes, it is such a benefit to them if they can recognize that they are at risk. So the Summit County Health Department offers a diabetes prevention program that people can sign up and take if they find out that they're at risk for type 2 diabetes. So at this event, if they find out that they have pre-diabetes or at risk, they can sign up for this class. And if they also have high blood sugars where they may be able to be diagnosed as diabetes, they can be referred to their physician, or if they're uninsured, then we refer them to People's Health Clinic. And so when they come to this event, they can leave with an action that they can go do to help take care of whatever it is that they have going on concerning diabetes. And another really important aspect of this whole awareness event and the whole month is just to help people be aware that it's all around us. And if you don't have diabetes or pre-diabetes, find out how you can help those around you who do.
I'm so impressed. So you're screening people, potential diagnosis, which we hope not, but it's out there. We know that. And then also these classes. I really like how you're encompassing all parts of that. It's not just you're not just focusing on one thing. You're really helping all of us to hopefully stay away and manage diabetes if we have to.
Yeah. Yep.
So Beth, how much does this affect People's Health Clinic? Do you see a lot of diabetes in your patient population?
Yeah, unfortunately, a large number of our patients are either diabetic, pre-diabetic. We treat all chronic diseases, including hypertension. We really are working hard toward, like I said, the education side of it, and just throw out any of those preconceived notions of what you think a diabetic is or looks like, because you and I could be pre-diabetic or diabetic and be walking around with the disease and not even know it. So this screening and on this Wednesday is open to anyone. That way you don't have to be a patient, you don't have to live in a certain area, just anyone that wants to come and be tested should come. Just come and find out, get the education, we'll have materials. It's actually a lot of fun. You get to see the clinic, see what we do, see where the health department is. And we literally, when you turn to go toward the hospital, we're the first building on the left. It's 650 Round Valley Drive. So just pull into the parking lot and come in. There's no registration required. We'll have the tables set up where you'll stop at sort of like stations. And you'll get the first screening that'll, well, they'll say if you're at risk. Because there's a certain number of questions that you can be asked, which will pretty much tell you whether or not you're at risk for diabetes. Like, are you constantly thirsty? Or Aimee would know better than I what the questions are. But if you are, then we send you down to the next stations. And then at the end, you'll get a little treat.
A treat.
Yeah, a clementine.
A healthy treat.
A healthy treat, yes, absolutely.
Oh, that's great.
But I wanted to just piggyback on what you were saying, Beth. It's a free event, so anybody can attend. Like you said, you don't have to be a patient or live in the area. It's from 3 to 6 next Wednesday, November 14th. And we would love to see anybody who is concerned if they may be at risk, if they have a family history of diabetes in their family, come on in.
Is it free of cost?
It's free of cost. It costs nothing.
Wow.
And some of our partners I wanted to mention as well, the American Diabetes Association, Wasatch Health Department, Summit County Health Department, the MARC is going to be there, NAMI for mental health will also be there. So we have some great partners involved.
Yeah, and then Intermountain will be.
Intermountain, thank you.
Yes.
Intermountain.
And what ages do you service?
Any age.
So children can come as well?
Absolutely.
Yeah, we encourage
There are
children.
more children who are being diagnosed with type 2 as the numbers just keep continuing to rise.
Well, I had a conversation recently with some people about diabetes, and I think, correct me if I'm wrong, but I think sometimes it's the last thing of your list of concerns of what might be wrong when you're feeling bad. You think of all these other things,
Yeah.
and then when you find out it's diabetes, you go back and see, oh, now it all makes sense. It's that big piece of the puzzle, but I think it gets overlooked.
It does, and at least the good thing about diabetes is you can manage it. Where there are many diseases where you have no control, at least with diabetes you can manage the disease and live a healthy life. It's just getting educated, which is what we hope to do.
Which just seems like that's the goal for People's Health Clinic as well as Summit County Health Department. And I think you guys are doing a wonderful job keeping our community healthy, servicing those of us who maybe can't afford health insurance, and also getting that information out there. So thanks so much for being here and talking about World Diabetes Day. Tell me one more time, next
Wednesday, November 14th from 3 to 6 p.m. at People's Health Clinic.
Perfect. All right, thanks so much, ladies, for joining us.
Thank you.
So you want to go check that out, just get at some education, find out if you are at risk. Take your family, take your children. It's a very important event, and we're very thankful to the health department as well as People's Health Clinic for hosting this great opportunity for us to learn so much more and to keep us healthy and well. We are going to be talking to Lindsay Hargett right after this about healthy Thanksgiving side dishes. You don't want to miss that. We'll be right back.